Now for the next type of jaundice which we are going to talk about is the breastfeeding-associated jaundice. Breastfeeding-associated jaundice. Now you might actually want to be confused about this. Okay, a woman is giving her child breast milk, which is good, but the baby can come down with jaundice. So you might actually want to know the connection between these two terminologies. So let's move on and see. So it typically occurs during the first week of life. So if you see a neonate having this jaundice and you ask for the age and it's usually the first week of life, you might be suspecting for this. Now, the jaundice is occurring because of insufficient milk intake. So probably the baby is not breastfeeding well. Okay, so this leads to the baby dehydrating because at that time you are doing exclusive breastfeeding, no water, no nothing. Okay, so the dehydration and there is increased resorption. Okay, so it is distinct from breast milk jaundice, okay, which appears later and is caused by substances in breast milk. Okay, so breastfeeding-associated jaundice is different from breast milk jaundice, right? So it arises when a newborn does not receive enough breast milk during the early days. So what is leading to it is because the child is getting dehydrated, delayed stooling, increased enterohepatic circulation of bilirubin. So as a result, unconjugated bilirubin builds up in blood. So this can actually cause yellowing of the baby. Okay, so what's the mechanism? Bilirubin is excreted in stool. So when feeding is inadequate, the baby doesn't have anything to stool out. So but the little stool that is starting to make will still be retained in the body. Do you understand? So bilirubin remains in the intestines for a long time and can get reabsorbed into the bloodstream. Okay, so it increases bilirubin levels in the body, and this could actually lead to the yellowing of the skin. So risk factors is the baby is not feeding well, delayed initiation of breastfeeding, infrequent feeding, maternal factors like low milk supply or lack of breastfeeding support, then prematurity. If the baby is premature too, this is gives it a more risk for having that condition. So clinical features, you have jaundice appear with between the 2 to 5 days of life most at times. Weight loss, signs of dehydration like dry mouth, low urine output. Do you understand? And management is just increase the breastfeeding so that the baby can stool. Okay, and supplementation, use express breast milk, donor milk. Sometimes you collect breast milk from other people if you are not making. Okay, then in the hospital they can do phototherapy if the levels are so high. Okay, so that's what we got for the clinical breastfeeding associated jaundice.